Welcome to Growing Smiles. Today we're going to talk about the baby boomer generation and the particular challenges that are actually faced by that generation as far as their oral health goes. We have grown up as a generation that has actually been much better off dentally. Access to dental care and the type and quality of dental treatment that has been available has meant that more of us are actually entering our baby boomer years. So those of us that were born between 1946 and 1964, we've entered our baby boomer years with more expectation of keeping our natural teeth for life. But there are definitely some things that develop and challenge us at this stage in life, and our teeth are only going to remain with us for life if we take the right steps to actually manage the health of our mouth and prevent problems that are more common in our later years. So we can do something to avoid some of the problems of the previous generations. And because more of us are living longer, and we're also retaining our teeth for longer into life, we have got risks of things like root decay with increasing age that may actually become more complicated because we've had complex dental care in the past, and that needs to be well maintained into our latter years. So aging isn't always pretty. Let's set the scene for this. Aging isn't always pretty, and our mouths are no exception. Some health risks strike without warning, and that may well complicate your dental care. And if you go back to our Facebook page, you will search for baby boomers. You will see that we have spent a week highlighting some of the challenges that the baby boomer generation actually face as far as their oral health care go. A century ago, the need for dentures in later life was almost a foregone conclusion. We hear many stories of people of the baby boomer generation whose parents, when you're trying to find out the history of the family history of oral health, has been, oh, well, you know, they lost all their teeth by they were 25, or they had dentures by they were 30, or even sometimes long before that. But today, 3/4 of the people over 65 retain at least some of their natural teeth. And for older people, we still suffer higher rates of things like gum disease, tooth decay, mouth cancer, and some sorts of infections and tooth loss. And while that's nothing to smile about, you can actually do an awful lot to keep your mouth looking and feeling much younger than its years and functional. When you think about what do we use our mouth for, I mean, you know, you need our mouths to eat, we need to speak, we want to look presentable and look well and have a lovely smile. And I think those social interactions that come with that are so important as we age. So dentures don't have to be an option. We just need to make the effort now to maintain our oral health and take care for the longer term. We've got to put oral health in context of overall health. And BASCOD, British Association for the Study of Community Dentistry, way back in 2015, commented that good oral health is an essential component of active aging. I think that's so important. When you look at how we socially interact as we get older, we rely on friends, family, those connections that we actually interact with, those social activities that are so important, communicating effectively, particularly, you know, if people are suffering from maybe stroke or something that is affecting their musculature, so their ability to speak clearly, you know, there's all sorts of things that can affect that, including dementia. So communication is really important, and your oral health is related to that. The ability to eat a variety of healthy foods and keep our oral health and our overall health connected are all impacted if our oral health is impaired. So we know there's lots of diseases linked with gum disease. And this goes back to my colleagues, Jerry Linton and Lewis Winning's work way back again in 2015 of actually the things that we know are connected, some more strongly than others. Now I'm going to come back to this. So just a quick overview. What do we know about as we get older? Well, we're more inclined to get gum recession. That exposes the softer root root surfaces of the teeth, and that can lead to cavities and tooth decay on the root surfaces. Along with that, you can are more likely to end up with more food packing and plaque biofilm packing in difficult to reach places, and that can exacerbate and complicate more gum problems. Chances of oral cancer increase with age. Tobacco use is a big one there, and again, I'm going to come back to that. Probably the single most significant factor is medications and the impact that they have on their salivary glands and leading to dry mouth, and then how a dry mouth actually impacts your oral health. It's something we don't always think about. Keeping your mouth moist. Now, if you go to the website, growindsmiles.co.uk, you will see along the top there's a menu that gives you a choice to select our healthy tips page, and go to that and you will find topics, and behind each one of those there's a considerable amount of information about the topics that are highlighted, and one of those is dry mouth and what you can do about it. It gives you a bit of background to how medication in particular affects dry mouth, amongst other things, even just being dehydrated, and how that can lead on to not only tooth decay, gum disease, but also bad breath, and that can be hugely impactful on our social interactions, again, particularly as we age. So we want to make the most of our health and staying healthy. And age, there's no doubt age does bring more health problems. I mean, it's a fact. And, you know, with that can mean multiple medications and what is often referred to as polypharmacy. And that might have a detrimental effect on your oral health. So things like calcium channel blockers for heart disease, anti-seizure drugs, that actually might make your gums a bit puffy, and particularly around your front teeth. But that's something that can be managed with really good oral hygiene. But, you know, again, really important to see your dental team so they can actually monitor and make sure that you're getting the best care possible. But there's hundreds of medications that have dry mouth as a side effect. We talk about xerostomia as the more technical term for dry mouth. And having a lack of saliva in your mouth is more than just being uncomfortable. It is really unpleasant. It can make eating difficult. It can make swallowing difficult. It can lead to bad breath. You get horrible coating in your tongue where the bacteria break down and form volatile sulfur compounds, and that can lead to bad breath. It also can leave you more likely to end up with irritations and infections. So if you wear partial denture or you have a lone standing tooth, so you've got maybe one molar sitting on the back on its own, and if your mouth is dry, you're going to be more likely to nip the inside of your cheek when you chew and bite. So you can sort of get this recurrent sort of trauma to the inside of your cheek. It might be really, really uncomfortable. And when your mouth is moist and lubricated, that is least likely to happen. A dry mouth also increases your risk for both gum disease and tooth decay. So you can find new cavities developing in quite a short space of time, as little as 3 months after you've had a dry mouth problem developing. So really, really important to recognize that your mouth is dry. Maintaining your hydration level is key. How do we suggest you do that? Well, keep an eye on the color of your urine. Your urine should be pale, very light, almost clear. The darker it is, the more dehydrated you are, and the more you need to increase your water intake. Sometimes that can be a real challenge. We often recommend with clients just getting a small glass, put it beside the tap. Every time you go past it, just drink that small glass of water. So you're doing it gradually. Don't get bogged down with setting yourself this huge task of having this huge big jug or bottle of 2 liters of water. I've got to drink that all day. Just sip regularly during the day, and that not only helps to moisten your mouth in the process of actually drinking and swallowing, but it also then helps you stay hydrated. There are a number of other things you can do to actually help with dry mouth. So you can chew things like sugar-free chewing gums. If you're a gum chewer, you can suck on sugar-free sweets or candies. You can use a number of gels, over-the-counter gels, we've got a number of products, including the little discs, the adhesive discs, the Xylomelts, which are particularly good for people with chronic dry mouths. And you just stick them the inside of your mouth, and they release xylitol. Now, xylitol is great because it works in two ways. You get xylitol, stops the bacteria that cause tooth decay sticking to your teeth, but it also actually helps to moisten and lubricate while it's there. Avoiding things that we know actually exacerbate a dry mouth. So things like alcohol, things that are caffeinated, drinks that are caffeinated. So keep those in moderation. Tobacco use is very drying. So again, there's another good reason for quitting, or certainly cutting down. But saliva gels, saliva products, and again, go and look on the website. We have a great range of dry mouth products that may well be something that is going to help you be more comfortable and your mouth to work more effectively and prevent problems developing. So the more medications you take, the more that's likely to impact on salivary flow. We call that polypharmacy, and it is normal overall just to see less saliva produced as we get older. So, you know, the problems are there. It is a big issue within the baby boomer generation, but something you need to talk to your dental team about. And it may not be obvious to them when you go to the dentist that your saliva isn't the best quality or quantity, but they'll be looking to see, does the saliva look frothy, does it look stringy, and they may well ask you, does your mouth feel dry? And what they may suggest is topical fluoride varnish or gel or foam to help keep your teeth strong, and maybe the use of a saliva substitute. But again, that's something you can talk to them about. Or if you're not sure, why not take time out for teeth with us? And that's our oral health coaching session, and we can talk about it. So let's move on. Mouth cancer. Hugely important for us all to be aware of mouth cancer risks. So many of these cases, 78% of cases in the UK occur in the over 55 age group. So that is you if you are a baby boomer. If you are caring for a baby boomer, live with a baby boomer, make sure they check their mouth every month. Many of us forget, and there's a month goes past and we just, oh, Rachel, I should have done that. If you follow the Grow and Smile social media platforms, it's the one reminder we put across all our social media platforms every month is Check Up Tuesday, where we advise you about checking your mouth for signs and symptoms of mouth cancer. So again, go into the social media, Facebook page, go on the website. Again, there's a link in the tips page for mouth cancers. But as with many cancers, the risk of developing a mouth cancer and oral cancer increases with age and also tobacco use. It's a major risk factor. Most people who do get some mouth-related cancer are tobacco users, but not all. The human papillomavirus is a big has a big impact here. The HPV virus, many people know about in relation to other types of cancers, but not necessarily mouth cancers. And it is one of the reasons why the dental profession's had a huge drive to actually vaccinate boys as well as girls to try and prevent HPV becoming a major risk factor for mouth cancers in the future. The incidence of mouth cancer has risen by nearly 50% in the last 10 years, and the 5-year survival rate has hardly improved in the last 30 or 40 years. A lot of this is due to late detection. So get into the habit of looking in your mouth. So when you're going to brush your teeth today, get yourself in front of a mirror, get a decent light, and have a good look so you know what is normal in your mouth. That way you're much more likely to be able to identify the abnormal. But the basic things are an ulcer, a red or white patch anywhere in your mouth that doesn't heal within 3 weeks. If it's still there in 3 weeks, get somebody to look at it, dentist or doctor, but get somebody to have a look at it. Likewise, a lump or swelling anywhere in your mouth, your neck or jaw. If you've got a difficulty swallowing, chewing, moving your jaw, your tongue, any numbness in your tongue or other part of your mouth that seems a bit odd, feeling that something's caught in your throat, that you're constantly sort of trying to clear, there's something there. Chronic sore throat that goes on and persists more than about 6 weeks, and any sort of unexplained tooth loosening. So if you've got gum disease and you've got a bit of mobility in your teeth, that's one thing. But if you get sort of more than you think, this is a bit abnormal, far easier to get it checked out and be wrong than not get it checked out and find out you have to deal with the consequences later, because treatment for mouth cancer can be very challenging. So way better to get it early, and the outcomes are much more positive. Risk factors, probably much the same as you would expect. Tobacco use is the main cause of mouth cancer. So if you smoke, most smokers I know or tobacco users would prefer to be non-smokers. Seek advice and help, whether it be from your doctor, talk to your pharmacist. Pharmacists are brilliant for actually identifying the right nicotine replacement therapy for you. And we do know that people who use some form of nicotine replacement therapy along with some sort of support are actually much more successful at quitting. Drinking alcohol in excess, and again, know your limits, know how much alcohol you're drinking, because it can increase the risks by 4 times. So, check, are you drinking 14 units a week or less? Are you having a couple of dry days that you're not drinking alcohol at all? It's very easy for 1 glass of wine over dinner to become 2 glasses of wine, to become, oh, well, we may as well finish the bottle. And that can become a habit. And it's not a good habit, because all of a sudden your alcohol intake has shifted dramatically. And alcohol use, it has increased and is increasing amongst the baby boomer generation, whereas we find with younger people it's actually reducing in many areas, but with the baby boomer generation it's actually increasing. A lot of that's to do with lifestyle changes. You maybe recently retired, just your social life, being at home, you're not driving, all sorts of things can influence that. Drinking and smoking together in combination, really need to do something about that, because that is a major risk issue. Things like poor diet also influence that. So poor housing, social deprivation, again, linked to 1/3 of cancer cases in the UK. Human papillomavirus, I've mentioned, something that many dental professionals are not comfortable talking about, but it is really important that it is transmitted through oral sex. And it can actually, or it's likely to overtake tobacco and alcohol as the main risk factor in the next 10 or 15 years. Lip cancers, I have a colleague who regularly picks up signs of skin and lip cancers around the face and neck when she's doing her mouth cancer screening, and exposure to the sun can cause skin cancer. And I say that's something we all need to be very aware of, and using appropriate high factor sunscreen to actually protect ourselves year round. Sun rays are still there. Okay, baby boomers and gum disease. Well, yes, it happens to us all, you may think, but does it need to? I mean, by and large, gum disease is preventable. And my mantra here is always that healthy gums don't bleed. And you think about your gums as the foundations of your mouth. So your gums, little fibers that hold your gums against your teeth, the underlying bone that holds your teeth in your jaw, those are all what we call the periodontium, the periodontal tissues, the gum tissues, and they are your supporting mechanism, the foundations of your mouth. If your foundations are dodgy, everything put on the top will eventually start to crumble. So, get your foundations sorted before you think about doing other sort of treatment. So you may be wanting to improve the appearance, you may be wanting to have some orthodontic treatment, but if your foundations aren't as good as they can possibly be, you are going to have problems down the road with that. So healthy gums don't bleed. The gums are reliant on you actually keeping the plaque biofilm at bay. So the plaque biofilm is the sticky stuff that gathers up in your teeth, and it gathers around the gum margins in between your teeth. And it can lead to good tooth loss. So gingivitis, bleeding gums, can develop into periodontitis, which is where the bony support starts to break down, and the teeth can become mobile. And periodontal disease is more likely as we get older. So if you get into good oral hygiene habits, that you're cleaning in between every single day and cleaning in between effectively, and brushing thoroughly get yourself an electric toothbrush. If you've never had one before, now's the time to do it, because our ability, our dexterity also can be compromised as we go through our baby boomer years. So aging itself isn't caused, but it can often slowly progress as we get older, and it can also get undetected. So really important, again, see your dentist, let them do that probing around and actually measure the level of attachment around where your gums are actually attached around your teeth. But the key is what you do every single day to controlling gum disease. Actually cleaning thoroughly with a toothbrush and some form of dental cleaning aid. And we've got loads of advice and tips like that on the Growing Smiles website. Let's have a wee look at the risk factors in a little bit more detail. And this actually comes from British Society of Periodontology's guidelines for general dental practitioners. But you know, it puts it so succinctly, I just couldn't ignore it. So there's things that you can modify. There's things that are in your mouth, the local factors that can be modified, and that will contribute to you getting gum disease. And there's systemic factors, again, that you can do something about. So things like smoking, diabetes, and we know there's a two-way link with diabetes. So, you know, diabetics get more gum disease, unstable diabetics get worse gum disease, do not respond as well to treatment. Periodontitis with diabetes is a bit of a challenge, to say the least. Per diet, certain medications can exacerbate. Stress is one of those things that we don't give credit for, how stress impacts our immune system. So often it's how our bodies respond to the bacterial plaque biofilm. So moving and controlling your plaque biofilm is key right across the board. But then there's systemic factors that actually influence how our body actually responds to that bacterial biofilm. So that's where smoking and diabetes, per diet, because you know you need micronutrients of vitamins and minerals to support healthy connective tissues, and the things that hold our teeth and our jaw are connective tissues. So per diet is a big impact. Certain medications, and I say stress impacts how our body responds. So the first thing always is trying to manage and control our gum disease levels, and is effective oral hygiene every single day. It may not be exciting, it may not be sexy, but my goodness me, it is effective. So it is worth spending time on. There's local risk factors that you can do something about and your dental team can do something about. So the plaque and calculus on their teeth. So the plaque biofilm I've mentioned, you know, round your gum margins in between your teeth. If it's left, it will form calculus or tartar. Once that's calcified, you can't get it off. You're reliant on a dental professional to remove that for you. It's just hardened plaque. But if it's left there, it becomes retentive. It holds more plaque biofilm there. It's a rough surface, more plaque biofilm will build up on that. And the most common places for those to actually develop are in behind your lower front teeth and on the outside of your upper molars. And in behind your lower front teeth is a really difficult place to clean around the gum margin. So, you know, there are tools, things like the Pixter's reverse focus toothbrush can be really handy for that. And using your toothbrush the long, narrow way instead of trying to get it in sideways, particularly if you've got any sort of crowding there. Sometimes if you've got open contact, so you've maybe got a space where you've maybe lost one tooth, and you've got the side of the tooth that your toothbrush doesn't reach. So the toothbrush gets the outside, gets the inside, and then you've got that space, you know, the tooth surface face onto the space, if that makes sense. And those can be really difficult to clean. Swing your toothbrush around, try and clean those areas, or use some form of interdental brush or single tufted brush can be really useful for this. And the bottom line is, managing your plaque biofilm takes time, and that's the one thing we are so bad at doing as far as our oral health care goes, is spending time. Other things that can be modified are if you've got a poorly shaped filling or crown or a bridge or partial denture that doesn't fit terribly well, which has a ledge on it or a rough surface. And that, again, it becomes plaque retentive, so it holds the plaque biofilm around your teeth. So what you can do is actually, your dentist or your dental hygienist or therapist will probably note that. And if you're not able to clean it properly, in some cases you can, because, you know, you're just really good at that and it's accessible. But if you can't, your dental team can actually modify the shape of that or may suggest even a replacement, but they will only do that if it is necessary. You don't want going to replace things unnecessarily. You know, there's anatomical things, so basically the shape of your teeth in your jaw, you know, the way you bite together, if you've got crowding, if teeth are sort of out of line, that just makes it more difficult to clean. Furcations, now furcations are where the crown meets the root of the tooth. And there's a little dip, there's a little concavity there, and that's a furcation. It sort of goes underneath the crown of the tooth in between the roots. And we know that teeth with furcations need extra special care, and they are the ones that are most at risk of progression if you're not really careful. But you need to get, if you've got periodontal disease, you nearly almost need to be a bit OCD about your oral hygiene and be really, really specific. Root surfaces, if you've got recession and root surfaces have been exposed, they all have grooves and concavities, and that's why the gold standard for cleaning in between your teeth on those root surfaces where your toothbrush can't reach are interdental brushes, because the bristles compress into that space and actually clean into the concavities, where floss won't. Floss will not clean a concave surface. Now, that's it. Something is always better than doing nothing, but you want to get the most effective thing for the effort you're putting in. Enamel pearls are just like little lumps of enamel that are sort of developed on the tooth surface. They can be plaque retentive, but they are cleanable. There's some things that you just can't change. Your socioeconomic status is one of them, genetics, family history, parents, grandparents. I know I'm at risk of my lower anterior teeth. If you look at the previous slide, go back and look at the previous slide, those are my lower front teeth, and I had one tooth that started to wander exactly the same places where my mother had serious gum problems, and we nipped it in the bud by straightening it out and actually making it cleanable. Things like menopause, pregnancy, hormone changes, you know, there's only so much you can do about those, and that can actually tip the balance that the bacteria in your mouth are getting the upper hand. So it's always know about where your tipping point is and actually managing to control that, and do something about it. This is just a slide which is really highlights what all these conditions have in common. You know, gum disease, heart disease, diabetes, we have got shared common risk factors: smoking, obesity, stress, cholesterol, high blood pressure, lack of exercise, aging in itself, and other inflammation in our body. So we know there's some established connections, you know, cardiovascular disease, heart disease, diabetes, adverse, so poor pregnancy outcomes, preterm and low birth weight babies. And we also know that there's other things that the researchers, the scientists are finding more about: links with rheumatoid arthritis, chronic kidney disease, cognitive decline, dementia, and memory loss, and also osteoporosis. So these are all links that are tied in with inflammation. So what you want to do is manage your inflammation, and the triggered inflammation in your mouth is that plaque biofilm. So cleaning thoroughly is key. If you're not sure how to do it for your mouth at this stage in life, why not contact us and we will help you. That's what we're here to do. We're here to help you have a healthier smile for life. Take time out for teeth. Make the investment to get the advice. And we're bringing on over the next couple of weeks an interdental cleaning one-to-one session that we send you a variety of interdental cleaning aids, and then we actually coach you how to use them effectively virtually. So look out for that coming on the Growing Smiles website. Receding gums. Oh, none of us like to look long in the tooth. You can end up with some sensitivity there, and it needs to be managed. Sensitive teeth are one of those things that often then mean that you avoid touching things, you reduce your diet because you worry that that's making it worse. And use a sensitive toothpaste. There's primarily two variants. I mean, you've got a pro-arginine variant, you've got fluoride of various varieties, actually, so there's three, and also you've got bioactive glass-based ones. So find one that works for you and stick to it. So there's plenty of the over-the-counter over-the-counter sensitive toothpaste that work really effectively for most of us, but you need to keep using them. And to get the maximum benefit out of any toothpaste, make sure you're spitting your toothpaste out, but not rinsing it away. Let the ingredients in your toothpaste stay around your teeth and work for longer. Maximize, get the bang for your buck, basically. Some of the more interesting newer products are things like Biomin F, Biomin C, which work with a bioactive glass, and they actually retain fluoride around the teeth for a much longer period and are really getting very, very exciting feedback from clients and patients about how this is helping to manage their sensitivity. With recession, the root surface is exposed, and as I mentioned earlier, when the root surface is exposed, it is much softer than the crown of your teeth, and you're much higher risk of root decay. So you may have not had a cavity in donkey's years, and all of a sudden you have got decay. And if you've got root decay, that can be due to having a dry mouth, recession, your self-cleansing mechanism doesn't work as well as it used to, like a lot of things at this stage in life. Your self-cleansing mechanism doesn't work the way it was. So in other words, your ability to actually run your tongue around your teeth and actually clear any little bits of food that would have been stuck, not just as good as it used to be. And you may well have more places for foodstuff and plaque bacteria to be retained around the teeth. So again, oral hygiene is really, really important. Prevention of root decay is and will be a big problem, but it's not inevitable. You know, we are retaining our teeth, and with that, we are going to be at increased risk of both tooth decay and gum disease and tooth loss if we do not keep on top of it. So your dentist may well prescribe a very high fluoride toothpaste, but definitely use a fluoride toothpaste. Spit the toothpaste out after brushing, but don't rinse it all away. Let the toothpaste stay around your teeth. Use your toothpaste last, so do your interdental cleaning before you brush or at a different time of the day, so the fluoride toothpaste gets to all the surfaces and gets to work for you, particularly last thing at night. If you know you're at high risk of decay, so in other words, you might have had some radiotherapy to the head and neck and your mouth is extremely dry, you've had damage to your saliva glands, or you have got extremely dry mouth, you might want to look at using something like MI Paste Plus, which is calcium phosphate and fluoride, and you use it like a moisturizer. So you actually rub it onto your teeth once or twice a day. And again, lots of information on the website about that. Your dentist may well suggest using or having fluoride therapy anywhere between twice and 4 times a year, depending on your risk. And it can be really difficult to know what your risk is of developing tooth decay or other problems. And I mean, you can go on the website, go under coaching, the bottom it says My Dental Score, and read about My Dental Score and find what your dental score is now at this stage in your life. And then actually you can go back and decide what you need to do about it. And that's a great thing also that you can take to your dental team and say, I did my dental score, because they use, if they use the provisor, particularly with them plan that uses the same basic system without the clinical input, obviously. But you can talk to your dentist about that and assess your risk. You can talk to us about it. We are here to help you actually prevent you having problems and keep your smile healthy for life. So far easier to catch tooth decay early. And root decay in particular can progress rapidly. And I mean, in such in 3 months, people can get quite dramatic root decay developing if they are not very careful, and particularly if their mouth is dry. A little bit more about cavities. All of a sudden you've got problems, you never had a cavity in your life, or you haven't had a cavity in 20 years, and you know, there's a bit of wear and tear goes on in our mouths. We put huge amounts of pressure on our teeth, and when we clench or grind our molars, you put about 200 pounds of pressure on. That is actually quite an amount of pressure to be wearing. But we have wear and tear, medications, decreased salivary flow, our diet, poor oral hygiene, basically all those things that we got away with in our younger years, we're not going to get away with just as well. That's where we need to really look at preventive care. being a much higher priority than it maybe is to many of us in our baby boomers years. So, you know, make sure you're seeing the dentist regularly, make sure you see the dental hygienist regularly, because they can actually make sure your mouth is in tip-top shape for you to maintain it every single day. And that involves your cleaning in between, your interdental cleaning, your flossing, and your toothbrushing, and doing that effectively. But you'll find cavities maybe developing around old fillings. You see, sort of get a bit of breakdown, and you get not only, as I say, root decay around the necks of your tooth, but around the margins of old fillings. No matter how brilliant old fillings or crowns or bridge work, you can get that. There's a little space there, and it can get more marked with wear and tear over the years, and you can get tooth decay developing in that, mainly because it becomes plaque retentive. And if you are eating sugars frequently, which is the big key denominator with tooth decay, the more often you put sugar in your mouth, the more likely you are going to have tooth decay. So it's a frequency and the length of time it's there. So if you're going to have a cup of coffee which is laden in sugar, as many of the over-the-counter posh coffees, the lattes, the mochas, and all the rest of it are, drink it all at one go. Don't sip it for the next 2 hours. Drink it all at one go. Get it over and done with, because that will be one sugar attack. And when you've finished eating or drinking that sugary thing, the saliva comes along afterwards in your mouth and tries to remineralize and heal the damage that has been done by the sugar attack. But the big feature there is time and saliva flow. So if you have poor saliva flow and you're not giving your teeth enough time to recover, you are going to end up with cavities developing. So the rule of thumb is keep sugary things to meal times only, and avoid them lasting at night before bedtime. You may want to increase the amount of fluoride or remineralizing products you use to counteract things like poor saliva flow or an increased risk of decay, particularly if you've had a history in the past of a lot of teeth filled or restored crowns, bridge work, that sort of thing. Because, as I say, best will in the world, there are 2 different materials, tooth surface abutting into some form of dental material, and that's always that's potentially your weak link there. Tooth discoloration, this is something that annoys many of us as we get older, and so many things are absorbed onto the tooth surface as we get older. We got all these little micro cracks and porosities in the tooth surface as we age. I mean, it's just one of those things, but that then absorbs stains and all sorts of discolorations from food and drink, the things we like every day. So tea, coffee, red wine, curries can do it, all sorts of things. So you get a certain amount of age-relating staining, which can be both intrinsic and extrinsic, to give your teeth a much more yellowy color. So as we get older with wear and tear, the enamel gets thinner, and the dentine, the way dentine actually is laid down internally within the tooth, where the heart of the tooth gets much, the pulp becomes smaller through the thickness of dentine being laid down, and the dentine, because it's much yellower, sort of glows through the enamel more. So you get that sort of yellowy sort of appearance as the dentine shows through. It also can get darker, but we do have options to actually try and control the staining on our teeth, particularly superficial staining. And I say, first call is always, I always say, go and see a good hygienist, a dentist that will actually clean your teeth professionally. See how bright they come up at that point through scaling. And there's a great technique called airflow and guided biofilm therapy. It's not used worldwide, but wonderful results as far as guided biofilm therapy of managing your plaque biofilm. And basically, you don't leave the dental hygienist in ship shape, and all you've got to do is keep it that way. Not asking much, I know that's a big ask, but it's really important that you try and put the effort in to maintain it. If you're getting stain gathering up on 1 or 2 teeth, as you can see up here, have a look and see where your toothbrush is catching. Are you brushing down the sides really well, but not brushing this? Is your toothbrush not connecting here? And actually getting that professionally cleaned, then you can actually turn your toothbrush the long narrow way and actually access those surfaces. And it's back to watching what you're doing, seeing what's different, what you need to be paying attention to. Things like old fillings, you can get these cracks and they will pick again up around the margins. Like I said in the previous slide, where cavities develop These are all things that start to break down, and you get those sort of little areas there that plaque become retained. And again, staining also gets picked up there. You may want to replace that, but certainly if you're wanting to whiten your teeth, I'm going to talk a little bit more about that. So you may want to talk to your dental team about tooth bleaching and tooth whitening. And you know, that's a great technique for actually improving your smile. But have it done professionally. Do not buy things over the internet. Do not try and go it alone without some sort of professional support. There's a reason why legally in the UK, the only people can bleach your teeth are dental professionals, because they know what they're looking at. They know if your gum tissue is healthy enough to support tooth bleaching. They will be able to recognize if you have a filling there, or if you have a tooth that has been root canal filled and it maybe needs some other sort of bleaching. You may find that your staining is not going to be lifted with that, and what realistically can be achieved. So if you're going to do it, speak to your dental team, because you may want to bleach your teeth first to the color that you want them, and then you will need any restorations replaced. So that might be crowns, it might be fillings, and that might be costly. So as I say, talk to your dental team. That's your first port of call if you're wanting to brighten your smile. But there is no doubt about it, as far as taking 10 years off you, it is brilliant for doing that. I think nearly sure I'll come on to that. I do later on. So let's move on. Toothwear. And again, it's a bit of the old aging process. It's the amount of pressure that we put on our teeth and the impact that those actually have on our mouths. It's probably, toothwear is probably greatly undiagnosed, that can lead down, something that can lead down to the breakdown of your teeth and breakdown of dental work. So you may start to fracture old fillings, and you may have problems with wear and sensitivity, possibly, but usually because it's a long gradual process, you're totally unaware of it from a pain point of view. But clenching and grinding over years can definitely impact on the anatomy and the shape of your teeth, and that can impact on your ability to chew healthily, your ability to bite your teeth together, even be able to, where you can bite into an apple and you're not maybe able to do that. So it can adjust the way you bite, and it can have serious consequences, not only to your natural teeth but also for dental restorations. But you can do something about it. Again, speak to your dental team. Your teeth are amazingly strong, but they're not indestructible, and you need to make sure that you are doing everything you can to stop more fractures developing. So, you know, thinner the enamel, the more likely it is to crack and fracture. And if that is a tooth that is maybe supporting a denture or some sort of bridge work, again, you may need to have stuff replaced there. So, you know, it may even get to the point that there's enough damage that may need to have root canal treatment. The likelihood of that, once we're over 65, actually triples, believe it or not. So, you know, the one good thing about it is you can have reduced sensitivity, because dentine is laid down as we get older and makes the pulp chamber where the nerve supply lives in your tooth smaller. But that is no good reason for ignoring tooth wear and aging dental work. Failing and missing teeth. Now, this is something we talk about at various lengths with people, mainly because people think, oh, I've lost a tooth, so it's all right, I'll just get an implant now. Number one, implants, they're wonderful when they're done well in suitable circumstances. Not everybody is suitable for dental implants. Not everybody can afford dental implants. Not everybody wants to go through the surgical procedures that are required to get a dental implant. And some people don't have the ability to maintain dental implants. They're not screw-in teeth that you just don't bother with. They are teeth that actually need you to be OCD about your oral hygiene. And there's a very well-known periodontal gum specialist who has said that unless you are OCD about your oral hygiene, you should not be considering implant therapy. These are like the Rolls Royce of teeth. you need to look after them, and they take time to look after. And the ease that they are to look after depends much on the design. Again, that's something that your dental team will take into consideration, that your ability to actually maintain and keep this implant clean, because the seal around where the gum goes around the implant is your protective factor. That seal is the deal, and you want to keep that seal really healthy. And we've got stuff about implants, or links to implants on the website, which will give you much more detailed information. But if you have recently got implants and you're not sure how to look after them, please book a slot for Time Out for Teeth and we will talk about it. That said, many people in the baby boomer age will have lost a tooth and will want it replaced for a whole variety of reasons. It might be infections, but if you look at this x-ray, you can see here there's been teeth lost, and this will impact the ability to chew and certainly appearance, and some sort of old dental work there that needs to be replaced. Dentures are always an option, and they can be, they are not that maybe what you've had in your head of your parents having a denture and a glass beside your bed. You know, they are much neater, they're beautifully designed, and they are personally tailored to your mouth. And again, they still need to be well maintained, whether it be full denture or partial denture. It can be one tooth, or it can be a number of teeth, and always easier to manage a denture on some of your natural dentition. So don't think just clearing all your teeth out and full dentures are your answer to a beautiful smile at this stage. Dentures need to be tolerated to be worn well and be successful and get you functioning as well as looking your best. So, you know, it's always easier to get a partial denture that is supported on a couple of natural teeth or on an implant. But again, this is a conversation that you need to have with your dental team about what you want, what you can afford to spend, and what realistically can be done within those parameters. But going back to the gum disease thing, you've got to get what you have as healthy as you possibly can. And that just comes down to time you spend on your mouth and looking after your mouth. So that's a little bit about failing and missing teeth. You know, do you have cosmetic concerns? And this is back to the tooth bleaching and the whitening. And Tracy Bell, who practices in Liverpool and on the Isle of Man, actually we borrowed a before and after tooth bleaching of one of her slides. You may have decided that you didn't have orthodontic treatment when you were a teenager, and you sort of feel as if the crooked tooth in your mouth could do with being straightened, and you've decided that that's where you want to spend your retirement fund, or you want to do something to improve your smile. It might be tooth bleaching, it might be orthodontics, it might be a variety of all sorts of restorative treatment. But certainly you want to make sure you have that conversation with your dental team. There's no doubt, I mean, I tend to think of tooth bleaching as sort of like a facelift for your smile, but you may want to have orthodontics. And it may not just be because you find that, you know, you've always had crooked teeth. In my case, this is where I put myself through orthodontic treatment, my orthodontic journey. You can follow that. Some of it's on YouTube, some of it's on our Facebook page. We did some of it with retainers, some of it I needed finally a lower fixed brace along my lower anteriors to get that tooth back to where it should belong. Now, I had perfect occlusion. It was my father was an orthodontist, and it was my one great claim to fame was I had perfect occlusion. So when this tooth started to rotate, in spite of my best efforts, I was really quite bothered by it. And I knew what the consequences of that collapse of my mother's lower anteriors, and I thought, right, well, I'm genetically predispositioned, but I need to get this under control. So my older brother happens to be an orthodontist, a professor of orthodontics, which is handy to keep it in the family. And he took it on board. And while we were at it, we decided to close the midline diastema. So the space between my two front teeth, which as many of my colleagues tell me was very much part of me, but we closed the diastema while we were at. And I have to say, I wondered afterwards why I hadn't done it 20 or 30 years ago. My father never was bothered, never interested in closing it, and that didn't bother me, so we didn't. But we've done it now, and what I have to do is now maintain this because I have fixed retention behind both my upper and lower anteriors. So again, while you have cosmetic concerns, and there's a lot that you can do about it, you've got to buy into the fact that you will need professional support to maintain it. So you will need regular hygiene appointments. You will need to see dental professionals to monitor it. And you will have to work really hard to make sure that this keeps up to scratch, that your oral care, your day-to-day oral care, so you do control your diet, you make sure you eat a healthy diet, you do exercise. All the things for a healthy lifestyle are also going to impact on a healthy mouth. And of course, your oral hygiene is up to scratch. Okay, so can you afford it? Big question. Dental treatment is not cheap. A lot of cosmetic work is not available on the health service, and you may have some sort of private scheme, which is wonderful. And I think that we're going to see more and more businesses offering dental benefits as well as private healthcare going forward. But I would argue, can you afford not to look after your smile? What you want to do is maintain what you have, and you want to maintain it really, really well. So you don't necessarily want or need to have a whole lot of expensive dental work. But what you want to do is make sure what you've got naturally is well looked after, because we do increase our risk of tooth decay and gum disease and wear and mouth cancer, and more commonly dry mouth, as we get older. So I would throw out to you, can you afford not to look after your smile? And that's doing the things that we talk about on Growing Smiles all the time. And if you need, and you will need, tailored individual support, that's what we do virtually with Time Out for Teeth, or oral health coaching service. So contact us, have a look at what we have to offer, and we can talk about it and see how best you can manage your smile in your years to come. We have a great tips page on the website, and you will, just going to go back. You can see on the tips page, these are basically the boxes that you can choose to pick. We have advice and tips with a live chat function on the website. We've got products that we know have a role in oral health care, and they're by and large products the professionals recommend and we can stand over. You can get your free dental score today by taking my dental score. And if you go to the Mind Your Mouth, the first box that you will come to on the tips page, you will see the oral health care tips that we have here. Everyday tips to keep you smiling. So brush around the gum and each surface of all teeth at night and one other time every day. You may want to increase that. You may want to use a fluoride. You definitely want to use a fluoride toothpaste. Spit out after brushing, but don't rinse. Again, based on your risk, you may want to use a fluoride alcohol-free mouth rinse at a different time of the day to when you brush your teeth. Clean between every day, use interdental brushes or flosses, whatever's appropriate for you. Reduce the amount and how often you have food and drinks containing sugar, and avoid them before bedtime. Really, really key messages there. So a sugary diet is something you really need to get under control for your health as well as your oral health. Eat more fruit and veg, drink plenty of water every single day. Chewing sugar-free gum after eating is really beneficial in trying to stimulate the saliva flow. And if you've got a dry mouth, look at some sort of dry mouth product that may help, particularly at night when it can be really, really difficult to sleep. Drink alcohol in moderation, if at all. Don't smoke, use tobacco products, and that includes shisha pipes or recreational drugs. And recreational drugs are not something that we always think about. And yet, actually, there was a study not that long ago that showed that recreational drug use is actually booming in baby boomers. That's maybe another topic for another day for me. Keep acidic foods and drinks to meal times and avoid them before bedtime, particularly if you've got something like gastric reflux, which again, I didn't mention that with the Toothwear, but that is something that is quite common as we get older. Gastric reflux, which actually it's like battery acid coming into your mouth, and that will erode the tooth surfaces. You do not want to go brushing your teeth immediately after any sort of acidic attack, because that will wear the tooth surface more. That is very much where something like Tooth Mousse MI paste, fluoride mouth rinse is really useful. Even just rinsing your mouth with water afterwards can be beneficial there. Be mouth aware, look out for the signs of symptoms of mouth cancer. Really, really important. Know what's normal in your mouth so you recognize the abnormal. If you've got an ulcer that you can't explain. So in other words, you haven't bitten your tongue or you haven't burnt yourself, and put a mark on your diary or your phone as to when day one was, so that you know when 3 weeks has passed and think, no, this is still here. I need to do something about that. Visit your dental team regularly. They are going to advise you how often you need to be seen. And that includes if you've got no teeth at all. If you've got full dentures, you still need to have your mouth assessed for the risk of mouth cancer. So they will say to you, they maybe say you need the hygienist every 3 months, you need to see me every 6 months, you need to see 9 months. We'll see you next year. It varies and it will fluctuate, because it will fluctuate on what they're seeing and your risk at that specific time in life. So when you go to your dental team, be very open and honest about your medical history, about the medications. Don't think they don't need to know that. It's amazing what our day-to-day lives and health issues, actually how they impact our oral health. So if you're taking supplements, you're taking vitamins or minerals, make sure your dental team know that, because it's all useful information for them to assess your risk and provide you with the appropriate care for your mouth at this stage in life. Want to know more about your oral health? Well, why not join us? Take time out for Teeth with me, book a slot, treat yourself to 15 quid well spent. Or if you're not sure about interdental cleaning, as say, look out for our new offering about interdental cleaning with me, again virtually, because that's easy. You do it at a time that suits you, and we can have a good chat and work out how best you can manage your mouth, not just for now, but beyond in the future too. Talked about this, you can get a picture of me there. So we've got advice, tips, live chat on the website, and great products and all sorts of support to help you have a healthy smile for life. We don't want to be a statistic. We don't want to be somebody as we get older that we're not looking after our mouths. So we need to eat well. We need to make sure our oral hygiene's up to scratch. We need to consider the fact that our medications can be having an impact on us. We need to take them, really important, but we may need to step up our home care routine to tip the balance in the favor of having a healthy smile for life. Look at your sugar intake. Can you switch to xylitol or a sweetener instead of having a couple of teaspoonfuls of sugar, even a half teaspoonful of sugar in your coffee? That's still a sugar attack, an acid attack in your mouth. Try and limit those the number of times you go. Make sure you see your dental team regularly. Make the appointment and attend. If you've got appliances, whether it be a denture, retainers, or anything that goes in your mouth, mouth guard, clench inhibitor, keep it clean. It needs as much TLC as your teeth do. So make sure that's cleaned every single day. And you can see again on other videos on YouTube or on our social media platforms, my preferred cleaning methods for appliances. And if you become unwell, it's really important that somebody helps you maintain your oral health. We know, particularly with COVID cases, that people who are really ill with respiratory disease, if they have a lot of bacteria that are related to gum disease in their mouth, that can actually be inhaled and create inhaled pneumonia. So oral hygiene when you are ill is really, really important. And if you care for somebody, it's something that a family member can do for somebody that is ill, but it actually has a big knock-on effect for overall health and maintaining the dentition, so that when they get better, hopefully they will be able to eat and smile and be confident in their fresh breath and their teeth. So listen, bottom line is, don't let your baby boomer smile bust. I mean, we're here to help you, help yourself, have a healthier smile for life. And that does not mean just because we're getting older that we need to give up. If anything, we need to look at our oral health as an integral part of our overall health. There's been a lot of articles published actually this month in the Lancet in July 21, published in the Lancet about baby boomers and looking after oral health in later life. So, you know, get your act together now, do something about it now, so that you hopefully will prevent problems in the longer term. And don't forget, Growing Smiles is here to help you. So please feel free to contact us, message us, all the usual ways of making help that we can to contact us so that we can help you have a healthier smile for life.